Hi everyone, today we are going to discuss a very important topic which is uterine fibroid. I'm Dr. Deepti Asthana, Senior Gynecologist in Fortis Hospital, Gurgaon and Director Kalosa Clinic. And today we are going to discuss this very important topic which is a major cause of abnormal uterine bleeding in many females. Now many females often keep suffering heavy menses for years in life when they discover they actually have fibroids after scan. So are you familiar what these fibroids are? Actually benign tumors that form in the uterine wall, often during a woman's childbearing years. In fact, a study suggests that up to 70% of all women are likely to experience fibroids before they turn 50. They are that common. Now, although uterine fibroids are not cancers, but they do cause problems such as heavy menstrual bleeding, pelvic pain, and infertility. Now, the exact cause of uterine fibroids is not known, but they may be related to hormone levels or genetics. Because fibroids are so prevalent in adult females, every woman is considered potentially at risk. That risk increases if your mother or sister has experienced fibroids. African American women are more likely to develop fibroids and tend to experience them earlier as well, often by age 30. Diet may play a role. Foods containing plant-based estrogens such as tofu and other soy products could increase risk. Likewise, diets high in red meat and low in fruit and vegetables are suspect, as is alcohol consumption. Now let us see what are the types of fibroids. I'm going to take help of my model. Now, based on the location of the growth, uterine fibroids can be divided into three types. Now, coming to the first type is the submucosal growth. Now, this type of fibroid, this grows inside the cavity of the uterus. These become symptomatic very early. Now, the other kind is intramural fibroid, which develops in the wall of the uterus. Now, the third kind is fibroids which grow outside the wall of the uterus. These usually become symptomatic late. Now, some fibroids may look like mushrooms and grow out from the surface of the uterus or into the cavity of the uterus. These are called pedunculated fibroids. Now, what are the symptoms we experience when we have fibroids? Now, many patients have very small fibroids which cause no symptoms or issues at all. These females discover fibroids incidentally on scanning in their preventive health checkups usually. However, others may have enlarged fibroids which affects women's quality of life by causing excessive bleeding or by placing pressure on the abdominal organs. These may have heavy bleeding with clots and may require frequent change of pads or tampons. Now, these complaints are much more with submucosal or intramural types of fibroids, whereas subserous fibroids, which are growing outside the uterus, these usually cause pelvic pain, lower abdominal heaviness, constipation, and bladder problems, depending on the location of the subserous fibroids. Now, fibroids within the womb may interfere with an embryo's ability to attach to the uterus lining, which results in infertility, miscarriage, or preterm labor. Now, when a woman with one or more uterine fibroids does become pregnant, the fibroids can make the pregnancy more uncomfortable. Increased hormonal levels during pregnancy can accelerate the fibroid growth. Now, coming to diagnosis, any gynecologist, upon knowing the symptoms, would suggest either a pelvic ultrasound or an MRI to confirm the presence of fibroids in the womb. Now, do uterus fibroids need to be removed? When women are told they have uterine fibroids, the first question they often ask is whether or not the fibroids need to be removed. Now, the answer to this question depends on a number of factors, including the size and the location of the fibroids, as well as women's symptoms. Now, most small uterine fibroids do not need to be removed. In fact, many women with uterine fibroids don't have any symptoms. For women who are experiencing symptoms, treatment options range from watchful waiting to the surgery. Now, if a woman's symptoms are mild and her fibroids are small, her doctor may recommend watchful waiting. This means carefully monitoring the woman's condition and taking action if her symptoms worsen. If a woman's symptoms are more severe, or if the fibroid are large, surgery may be recommended. We'll deal with the treatment of uterine fibroids in some other video in our next series. Now, another important question is about uterine fibroids after menopause. Now, typically if we see the size of fibroids, it shrinks after menopause because of the decrease in hormones. But some may still continue to grow. The treatment is typically not necessary, but if the fibroids are causing symptoms, they may be removed surgically. Now, to conclude, a woman's chance of developing uterine fibroids increases with age. These tumors are common benign lumps that can cause a variety of symptoms. The size and the symptoms of uterine fibroids vary from women to women. Now, the treatment options depend on the size as well as symptoms of the fibroids. Some may require only watchful waiting, while others may need surgery. As I told you, we'll be discussing the treatment option in our next series of video. Hope you're better informed about fibroids with this video. Do catch up on my other video to learn about treatment options available for fibroids. Thanks for watching till the end, and you can also visit my website drdeeptiasthana.com for any gynae related issues or follow us on Instagram. Subscribe my channel Kalosa Gynae, where we talk everything about female reproductive health. Bye and take care.